Thank you for taking the time to listen to our presentation today, and we hope you guys learned a thing or two. My name is Beckie Luddington.
And I'm Sarah MacPhee.
And we are two second-year respiratory therapy students currently studying at Dalhousie School of Health Science. We wanted to point out as well that we are in the same bubble, so that's why we don't have masks on right now.
So today we are going to be talking about the effects of smoking and vaping on the cardiopulmonary system.
So our learning topics today are going to be statistics, what is the cardiopulmonary system, some basic anatomy, what is in the air we breathe, what is smoking and vaping, contents of cigarettes, negative effects of smoking, smoking as a risk factor, impacts of smoking on exercise, contents of electronic nicotine delivery systems, negative effects of vapes, diseases associated with smoking and vaping, as well as some helpful resources.
So just a heads up for you guys, we will be doing a game of Jeopardy at the end of this presentation, so make sure you pay close attention. Don't worry, there will be a few helpful hints along the way to make you focus more on some of the important topics.
So one of the scariest things about smoking is that it's one of the leading causes of preventable deaths in Canada. And in Nova Scotia alone, 1,700 people die annually from smoking-related illnesses. So a quick fact about vapes is that in 2019, there was a reported 34% of students in grades 7 to 12 that admitted to trying a vape product.
To start off, let's dive into what the cardiopulmonary system actually is. So our cardiopulmonary system is the relationship between the heart and the lungs. We will dive a little bit into the anatomy on the next few slides, but the cardiopulmonary system includes the heart, vessels, blood, trachea, bronchi, and the lungs. Our cardiopulmonary system is extremely important and essential as it is what is responsible for the transport of oxygen to our body's cells and to eliminate carbon dioxide. Because these systems work hand in hand together, it is extremely important to understand how smoking impacts each of these systems. As you can imagine, if one is damaged, the other is going to be affected as well.
So now let's move on to some basic anatomy. So let's start by looking at the anatomy of our hearts. Our heart is a muscle that's located slightly to the left of your body. So if you make a fist, that's roughly the estimate of how big your heart is in your own body. So it's easier if you think of your heart as having two sections, the left and the right. The top sections of the heart are called the atriums, and the bottom are the ventricles. These parts of our hearts are separated by what are called valves. So you can take a look on the image on the slide there, and it should show you a little bit more of a better idea of how the heart is separated.
I'm sure we are all aware of what the heart is and how important it is, because we couldn't function without it. Our heart is actually a muscle that has a pump-like function. You can think of your heart as having two separate jobs in the left and right sections. The right section of the heart is what pumps blood into our lungs to pick up oxygen and drop off carbon dioxide. From the lungs, the oxygenated blood then gets transported into the left side of our hearts. There, the left side's job is to then take that oxygenated blood and deliver it to the rest of our body tissues.
So we might be a little biased because we are future respiratory therapists, but our respiratory system is extremely important. The respiratory system is what enables us not only to breathe in fresh air, but also breathe out our waste products such as carbon dioxide. The respiratory system starts at your nose, where air is heated and humidified, travels through the pharynx, through the larynx, through the trachea, and then lands in the lungs. For those of you that might be a little bit confused and don't know these terms, our pharynx is our throat, our larynx is our voice box, and the trachea can be also called a windpipe. So we can think of the respiratory system as being divided into upper and lower. The upper being what is at the top of our bodies, our nose, mouth, throat, and voice box. Hint, hint. Once you start to go lower down the body and hit the trachea, and then your lungs, you're in the lower respiratory tract.
So let's dive into the respiratory system in a bit more detail. I want you all to rest one hand on your chest and one hand on your stomach and take a really big breath. The power that pushes your stomach out is the power of your lungs. The trachea branches off into a left and right tubes that are called bronchi. Each bronchi then branches off into even smaller tubes called bronchioles, which then lead to a cluster of tiny air sacs that are called alveoli, much like a tree with its trunk, branches, and then leaves. These alveoli are what provide our body with the ability to transfer that air to the blood to be able to get back to our heart to get pumped out to the rest of the body. Our lungs have about 600 million of those tiny alveoli. To put this into perspective, if you were to take each of these tiny air sacs and spread them out, it would cover an entire tennis court. Crazy to think about, right?
So do any of you guys have any guesses at what is in the air that we breathe? Although most people might think that our air is made up of primarily oxygen, it's actually not correct. It's made up of 78% nitrogen and only 21% oxygen. So most people, including me, were not aware of this, and still might not be, that nitrogen is actually an extremely important part of our breathing. The nitrogen in our lungs helps to keep the airway open, which allows other gases to do their job and bring oxygen in and carbon dioxide out.
So now that we have a basic understanding of our cardiopulmonary system, what actually is smoking and vaping? Although I'm sure most of you know what smoking is, we want to provide a more precise definition for you all to have in mind for the duration of the presentation. So the PubMed database defines smoking as the willful or deliberate act of inhaling and exhaling smoke from burning substances or agents held by hand. Smoking does not solely impact one population, but impacts people of all ages, including unborn babies, infants, children, adolescents, and even seniors.
So PubMed defines vaping as the inhalation of vapors produced by electronic nicotine delivery systems, otherwise known as vapes or e-cigarettes. They are considered non-combustible tobacco products, and as you can see from the photo, they come in all different sizes and shapes. They are essentially work by heating a liquid containing nicotine and other harmful ingredients and turning that liquid into an aerosol or vapor to be inhaled.
So the big question is, what's actually in a cigarette? So the Food and Drug Administration, or the FDA, have identified 93 hint, verified harmful and potentially harmful components in federally regulated cigarettes. Out of those 93, 32 are known cardiopulmonary toxins, and 85% of them are known carcinogens. For those of you who don't know, carcinogens are essentially substances that are known to cause cancer. Some of the chemicals you guys may recognize would be acetone, which is found in nail polish remover, butane, found in barbecue lighters, methane, the gas emitted from feces, ammonia, a chemical used to clean toilets, and cadmium, which is found in batteries. And this isn't even all of them. Now, I don't know about you guys, but those are not things that I'd willingly breathe into one of my vital organs.
Not me. So here's another photo of what cigarettes are made of. Some more things you guys should be familiar to, as some of them are even in your house. A few more examples are candle wax, rocket fluid, paint, acetic acid, toluene, insecticide, and poison, just to name a few. Have we gotten the point across that cigarettes are harmful?
Before we get into the more serious impacts of smoking and vaping, some quick impacts of smoking on you would be bad breath and yellow teeth. Along with this, the smell of cigarettes will be present on all of your clothes. You'll be at an increased risk of getting colds, your cough will increase, and not to mention your wallet size will start to decrease. A quick fact for you is that if you were to only smoke one pack of cigarettes a week, this would still equal $312 a year. But as you may know, it is common for smokers to smoke a pack a day, which would add up to $2,190 a year. Think of what you could do with that money.
A lot. So smoking cigarettes damages your lungs and respiratory health in multiple ways. As we've talked about earlier, the alveoli in your lung, which are the air sacs that give you the ability to transfer the air we breathe into our blood and allow it to circulate, are damaged with smoking. Our airways become damaged, and if this continues further, you can develop lung diseases such as COPD. This ruins the elastic portion of your lung, which makes them unable to snap back as fast when we breathe out. We'll go into further detail about what this disease is in slides to come, but we want to just put it into perspective for a second. I want you all to take a deep breath in, and instead of breathing it out quickly, count to 4 seconds in your head while you breathe out. Do that multiple times and see how tired you get. It's just a quick glimpse into how people with COPD breathe on a day-to-day basis. Smoking is not only known to cause 90% of lung cancers, but it can also trigger or make an asthma attack worse. If you take a look on the photo on the right, this is a real image of human lungs. Obviously, the lungs on the right being the healthy and the lungs on the left being a smoker's lungs. That's pretty terrifying.
Moving on to the negative impacts of smoking on your heart, not only does it cause stroke and coronary heart disease, but it also does damage to your heart in general. Our heart already has to work so hard. It serves as a pump that keeps us all alive. I know I wouldn't want to make it work any harder than it already is. This is what smoking does. It puts even more work on your heart. It increases your heart rate, increases the risk of blood clots and blockages that can then reduce blood flow to your legs and your skin. None of these things sound very fun, do they? By choosing to smoke, you are choosing to increase your blood pressure, increase your risk of heart disease, and decrease your overall heart health.
We've also learned that smoking is a significant risk factor for congestive heart failure. Congestive heart failure is essentially when the heart is unable to keep pumping out the amount of blood it needs in order to supply the body. This occurs because smoking increases our low-density lipoprotein, which are high in cholesterol. Cholesterol can cause plaque to build up in your arteries, making it harder for the heart to pump through. Picture a hose. It requires a lot more pressure to push water through a small tube than it does a larger tube. This buildup of pressure not only affects the heart, but can then impact your lungs because the pressure can cause the water to seep into the lungs, leading to what we know as pulmonary edema.
We are now also aware that smoking increases your risk for peripheral vascular disease, aneurysms, and Raynaud's disease. Smoking is a leading risk factor for peripheral vascular disease. Peripheral vascular disease is essentially what we were discussing on the previous slide, in that it is a narrowing of our arteries which can affect blood flow to major organs and your extremities. Smoking is also related to aneurysms, which is a weakness in the artery wall causing it to become enlarged, which, if you can imagine, can cause a lot of damage if it bursts. I'm sure there are many of you who say they have poor circulation when it's cold out. Well, smoking is a risk factor for Raynaud's disease. Raynaud's disease is essentially a severe form of poor circulation that is hyper-responsive to cold temperatures or emotional stress. Many of you may say, oh, well, no, this won't happen to me, but it is actually most common in the teenage years and to the 20s of females.
So I'm sure there are a few athletes in the room, or that at least a few of you care about your athletic performance. Well, as I'm sure you can all guess, smoking has an impact and can have a negative impact on your athletic abilities. One research team performed a study on the impacts of smoking on Taekwondo athletes' recovery. They found that smokers' ability to transport oxygen was lowered due to the increase in carbon monoxide that binds to your blood cells when smoking. This is essentially a milder form of what occurs when you have carbon monoxide poisoning. This decrease in the ability for hemoglobin to transport oxygen causes the body to increase its heart rate in order to compensate. This results in a longer cardiopulmonary recovery time as the heart rate rises and stays risen. It can also cause your muscles to get tired a lot quicker than they normally would. The tar found in cigarettes also stimulates both mucus production and tightening of the airways. These two factors together make it much more difficult to inhale as it narrows that passageway. To make this a bit easier to imagine, think about breathing through a straw. The smaller the straw is, the more difficult it is to get air in. The more mucus production also results in an increased diffusion distance, resulting in poorer gas exchange. This means it not only is more difficult to get oxygen in, but it's more difficult to get that carbon dioxide out. For obvious reasons, if a smoker or a vapor would like to increase their athletic performance and health, decreasing their smoking will improve their cardiopulmonary function drastically.
So the next big question is, what is actually in a vape or e-cigarette? So although vapes are often viewed as being less harmful than cigarettes in some ways, it does not mean they are without risks. By vaping, you are increasing your exposure to harmful chemicals. As we have previously discussed, the chemicals in cigarettes and the harmful effects they have, I want you to all think about what will happen when you then introduce a dozen new harmful chemicals that are not found in cigarette smoke. There are over 1,000 flavors of e-cigarettes out on the market. Maybe initially that sounds like a lot of variety and good tasting flavors, but I want you to all think of that as there are over 1,000 different chemical variations in e-cigarettes that can cause damage to your body in different ways. When heated, these chemicals also cause some reactions. These reactions often result in the creation of even worse chemicals such as formaldehyde.
Using electronic cigarettes that have nicotine in them can cause you to develop a nicotine addiction. Yep, you guessed it. This nicotine addiction can increase your likelihood to begin smoking cigarettes, causing you even more damage. It's also been found that vaping with nicotine can also alter a teen's brain development.
Like we had previously discussed, because vaping is a newer trend, the long-term effects are still unknown as the research is ongoing. That being said, across 15 studies, research has shown that short-term use of e-cigarettes has led to not only an increased airway resistance and inflammation, but also a decreased vital capacity when using e-cigarettes, whether they contain nicotine or not. For those of you wondering what vital capacity is, it's the maximum amount of air that you can breathe out of your lungs after a maximal inhale, which essentially means Vaping affects your ability to take a deep breath and to push that air out.
Doesn't sound very comfortable.
No.
So as I'm sure you most have heard, or maybe you didn't, last year in the United States, there was an outbreak of severe respiratory illnesses that were linked to vaping. When the doctors performed lung biopsies on these patients, it revealed sudden non-specific lung injuries, including alveolar damage and pneumonia. For those of you who don't know, lung biopsies involve a doctor going in and cutting out a small portion of the patient's lung and examining the cells. And for those of you who might not know, pneumonia is a collection of fluid in your lungs. So think about the last time you were sick and you were coughing and coughing, but it just wouldn't do the trick. That's what pneumonia is, but constant. The thing about these findings that is so scary is that they currently don't know how the injury occurs or how to fix it, besides not vaping at all. But the lung injuries did lead to death in certain patients as well.
For some of our more visual learners, this is a fantastic photo of what vaping does to both your heart and your lungs. Although a vape pen seems harmless, especially when you consider its use as a smoking cessation tool, we are here to tell you it's not that simple. Vaping and e-cigarettes increase the resistance in your airways and increase your airway reactivity. Basically, what this means is this increases the difficulty and comfort of bringing into your lungs. As we previously touched on, and will touch on in greater detail in the slides to come, vaping also increases the risk of various lung diseases such as emphysema. Not only does vaping impact our lungs, but our heart has to work harder as a result from vaping. It increases our blood pressure, aortic stiffness, our heart rate, and has effects on our ventricles within our heart and how much blood it is able to pump out per beat. These effects are serious, and although it may seem like I don't vape that often, so that will not happen to me, the scary truth is that our world still does not know how quickly these effects occur and what else occurs because vaping is such a new trend, and research is still being done. I don't know about you, but the unknown effects are pretty scary to me.
Me too. So we just wanted to provide you guys with an image of how vaping has been shown to impact the lungs. So this is a CT scan, which stands for computerized tomography scan. For those of you who don't know how to inspect a CT scan, which I didn't know prior to this, essentially the darker areas is air and the white or gray areas is more solid. It could be tissue, mucus, or a bone. So knowing this information, you should be able to see that there is much less air in the vapor's lungs on the right when compared to the image on the left. Not only that, but it also appears to have excess mucus or tissues in the lungs on the right.
So now let's take a look at some of the diseases associated with smoking and vaping. Although there has not been any concrete evidence connecting vaping with certain diseases, as its popularity is still relatively new, there are clear links between smoking and the development of COPD and even lung cancer. I'm sure there are a few of you who have heard of COPD or know somebody who has COPD, but I'm assuming most of you don't know exactly what this is, or at least I didn't know until I got into respiratory therapy school. So it is important to note that smoking is the leading cause of COPD, but now, what is it? COPD, or chronic obstructive pulmonary disorder, is actually an umbrella term for both emphysema and chronic bronchitis. Essentially, your lungs are like a balloon. You should be able to stretch them out as much as you want and have them return to their original shape. What COPD does is cause these balloons to lose their elasticity or ability to return to that original shape. This means that you can get all the air in that you need because they're already stretched out, but it makes it super difficult to breathe all your air out and get rid of that CO2. This is why some people with COPD have a big barrel chest. It's because they breathe in staying in their lungs and keeping their chest inflated. It can make you feel out of breath even when performing simple tasks such as getting dressed in the morning when the disease has progressed. Luckily, COPD is a preventable disease, and quitting smoking is the best way to slow the progression of this disease.
So here's just a nice picture that outlines the difference between a healthy lung and a lung with chronic obstructive pulmonary disorder. A quick fact for you is that we as respiratory therapists help to determine whether or not people have chronic obstructive pulmonary disorder by doing a breathing test called spirometry. Along with this breathing test, they also have to have a few of the associated symptoms: chronic cough, wheezing, shortness of breath, tiredness, just to name a few. Hint, hint.
As we had previously discussed, cigarettes are filled with toxic substances, some of which are known to cause cancer. This is why cigarette smoking is the most common cause of all lung cancers, because you are breathing these harmful substances directly into your lungs. As you are exposed to first or secondhand smoke, the cells of your lungs are becoming damaged. With repeated exposure and damage, it will eventually get to a point where your body is unable to repair these cells. This continuous damage to the cells results in them acting abnormally, which can result in cancerous lung tumors. This is why smoking cessation is so important. Even if you have been smoking for years, quitting smoking can still reduce your chances of developing lung cancer.
For obvious reasons, quitting smoking and vaping is the best way to lower risk of damaging your cardiopulmonary systems in the way that we've outlined throughout this presentation. For this reason, we wanted to provide you guys with some smoking cessation resources that are available right here in Nova Scotia. As of 2019, Champex and bupropion, two drugs that have been used to help quit smoking, are now reimbursed annually in Nova Scotia under Community Service Pharmacare, Seniors Pharmacare, and Drug Assistance for cancer patients.
Tobacco-Free Nova Scotia also provides free evidence-based tobacco cessation support in order to help people not only quit smoking, but also to maintain their smoking cessation. There are multiple options to seek help if you are interested, including calling 811 and getting your own counselor and quitting plan. You can also text Smoke Free to 1-902-700-7700 and receive motivational messages along your journey, or you can simply chat online with a counselor. It is important to note that this support is not only available in English. If you're even thinking about making a change in your habit or smoking, please reach out to these resources. Any step is a step in the right direction.
So that's all we have for you guys today. Thank you for listening to our presentation. And if you have any questions, our emails are both listed below, and we're more than happy to help. And if any of you guys are soon-to-be graduates and you're interested in the respiratory therapy program, please don't hesitate to reach out to us if you're curious or want to know anything at all. Thank you guys.